And I wanted to start off by just kind of level setting a little bit and talking a little bit about what is informed consent. Because while we're here today talking about our solution as it relates to the form, we understand that it is more than just the form. Informed consent is the communication and the process that takes place between the provider, the nurse, the patient, the family about that procedure or test being recommended. So it is in totality that conversation and discussion, but the form does play an important role in documenting that that communication occurred. So the better the form, we can hope that the better informed conversations are going to happen. And as you can see at the bottom of the screen, just a quote from Joint Commission, and this is likewise through many governing bodies, the ultimate goal of informed consent is for the patient to be an educated participant, to have that shared decision-making about the patient's care, about the procedure that's being proposed, and that the document serves as evidence that those discussions took place. So again, while we're talking about the form specifically, we know that it is more than the form, that it is about the entire process. And FormFast can definitely help make that process much easier and much more comprehensive. So in looking, let me click forward. There we go. CMS currently has guidelines for informed consent, and they've divided it into the minimum elements required on an informed consent form, as well as additional elements that would comprise a well-designed form. So if you look at this generic form on the right-hand side, the minimum elements that CMS currently outlines are the facility up at the top here, as well as what the procedure or treatment being performed is, and who is performing that procedure, the provider, and then a statement. So in the middle here, we can see a statement. It's not a comprehensive list, but it is just a statement that the procedure, benefits, risks, alternatives were explained to the patient. So not a light item list per specific procedure, but just a statement that yes, this conversation took place. And then finally, at the bottom, we can see signature for the patient or legal representative signing this document. So that's the minimum elements. The well-designed form, CMS goes on to say, would also include the provider who conducted the discussion. So sometimes the discussion is given by one person. The performing provider might be someone else. There might be multiple providers, a nurse explaining, the provider performing. So in documenting who was involved in this discussion. Also, in addition, having a witness signature that witnessed the discussion taking place with the date and time. A list of risks, so not just that general statement, but specific lists of risks for that specific procedure. And then a statement that talks about who else might be included in that procedure, whether it's a physician's assistant, a resident, NP. And so that is the current guideline for a well-designed form. It still poses a bit of a problem because we know through various studies that most informed consents do not meet CMS guidelines, even the minimum elements, let alone the well-designed consent. And the example that you're seeing on the right here, hopefully, is a worst case scenario of consent forms that you might see. But I'm sure they exist, and they may even exist in your organizations right now. Number one, this is a handwritten, very general consent. And I have been a nurse, like Erin said, for 20 plus years, but I'm not a urology nurse. So I had to actually look up to see that an RRP is a radical retropubic prostatectomy. And I could figure out that that plus minus with the B meant that with or without bilateral something. And I had to look up the PLND to be a pelvic lymph node dissection. So if it's that difficult for a clinician to try to interpret and inform consent, imagine the moment that the discussion is over, provider leaves the room, and now patients and families are left with this consent form. And we know from several studies also that patients can forget 40 up to 80% of what is told to them directly in a visit. So this would definitely not be a very good supportive document to help the patient understand what procedure he or she is consenting to undergo. Additionally, you can see more abbreviations. You can see that there are some things that you can't quite read from that handwriting. So we can certainly do better with an electronic form, and not only that, the workflow around it to make a very well-designed form. Now, CMS has also understood that this is continuing to be an issue and that we do need to really focus on patient understanding being those shared decision makers in the informed consent process. And so they have recently issued a request for public comment on this proposed quality measure. It's a mouthful, the Quality of Informed Consent Documents for Hospital-Performed Elective Procedures Measure. So this was out for public comment, and then just in the beginning of this month, the beginning of August, the final rule was published that had statements in response to all of the public comments. But the idea behind this proposed rule was to supplement, to help support the existing CMS guidelines, but also put a little more meat, a little bit more oomph behind them to really support a well-designed document that is going to enable that communication and shared decision making to happen. So the form that you're seeing on the right-hand side of your screen is an abstraction tool that was developed. Initially, it was developed in 8 hospitals and then tested in an additional 25. So there were 33 organizations that were a part of developing and testing this tool to help evaluate the robustness, I should say, of informed consent documents. And so you can see that there are points assigned for different types of items. And it starts off with just the basic description of the procedure. And not only what the procedure is, but is it typed? So you're getting points if it is a electronic format of some sort, of a typed form that is easy to read. Going on to say, how is that procedure being performed and is it typed? What's the rationale? What are the benefits? The risks, and not only just the risks, but is there a quantitative probability listed, a qualitative probability listed, and any alternatives to those procedures? Now, at the very bottom, the timing portion I thought was very valuable, because how many times, how many instances do we have informed consents happening in the pre-op area, in the OR, on the day of surgery? And that really is not an ideal environment for a patient about ready to undergo a test to be able to ask questions, have a discussion, receive education. So it's not an ideal time. And CMS is recognizing this and giving away to 5 points to ensuring that the informed consent is signed at least 1 day prior to the procedure. And in that timing section, additionally, there is consideration for listing the date of the procedure, the date of signature, or the opt-out on the patient for signing at least 1 day prior. So as you look at this proposed rule for this tool and think about the informed consents that you currently have in your organizations, how do you think your consents would score? Now, the proposed rule says initially a threshold of 10 would be proposed, so just half of the points possible, and then increasing that over time as people become accustomed to the measure and start making changes. Now, in that final rule that came out at the beginning of the month that I was talking about, CMS did say that they plan to submit this measure for NQF endorsement during the next appropriate call for measures. So this is something, while it is not in existence at this time, it is something that is coming. And if it is in this specific format, they're based on the responses given. Some of the issue was with this is evaluating the quality of the document, not necessarily the quality of the discussion. And they acknowledge that that's true, but this is a start. This is the first step to having a very robust document to enable that conversation. So the FormFast and informed consent solution really lends itself to this whole idea of having that comprehensive communication piece of informed consent. Now, I'm just showing you a screenshot now. Cliff is going to give you a demo in just a moment. But the FormFast Informed Consent is seamlessly integrated with your EHR. So you're able to be in your EHR and either pick a consent from a list. Cliff will talk a little bit about how we can automatically have consents be available for the appropriate procedures for the appropriate patient. You can see in the example on the right that there are some pre-filled areas, so we can pull information from the EHR to pre-fill any data that has already been entered to save us time. And it's also fully customizable with your logo, with your language, with whatever your consent form needs to say. You can see that there are fillable fields for free text. There are drop-down fields for drop lists to choose from a list of information. There are also check boxes. And you'll also see in the middle of the screen that there are hyperlinks to additional content. So even within this form, it is really kind of a living, breathing document. You can link to a video about a particular procedure or link to a pamphlet that will provide additional information about that procedure. So now, instead of just being a form, it is a tool to engage the patient and family and have discussion and conversation. At the bottom left, you can see the e-signature area, so you can have as many signature fields as you need. You'll also notice that it is highlighted in red, and that indicates that it is a required field. So within any fields in the informed consent for FormFast, we can have those required areas. Also with the signature, there's automatic date and time stamping, so you can preserve the integrity of the data as it was upon signing. And you also have the ability to append these informed consents. So sometimes there's a discussion that happens with the patient, signatures are obtained, but you need an additional signature. So we can append this form and even route it to the appropriate next step for additional signatures. We can also enable alerts to alert someone of incomplete forms, so you know well in advance forms that are complete and forms that are not complete. And then, like I said, the integration with the EHR allows for immediate archival of this completed form into your system for immediate viewing by the OR, by any staff members that need to access this form. FormFast meets the needs of informed consent really on both the inpatient and the ambulatory side of things. I come from an outpatient world, and so that is something that I readily identify with. And especially for this proposed measure for elective procedures, most of the conversations about an elective procedure happen in the ambulatory environment. But a lot of times that consent form isn't signed until the day of surgery or until they're in the operating room. Or perhaps there is a paper form that is completed, but then it is faxed over to the facility where it has to be held, can potentially be lost. So why not have this form easily available at the bedside in an outpatient visit to be completed and immediately routed where it needs to go prior to the procedure. Likewise, on the inpatient side, patients and family are already under stress. They're in the hospital. And so having a consent form that is easy to understand, that has the educational content within the form, with the mobile bedside option to make it very easy to access for patients who are in the hospital bed. And again, once this form is completed, it's instantly available to that OR staff. So the workflow is improved. But overall, it's about patient safety, shared decision-making, and really engaging the patient and family in their care. And you can do that with this type of form. So just circling back to that proposed abstraction tool for scoring your informed consent, FormFast really does identify with every item on this list. So for the top portions, we offer those procedure-specific forms that have typed details to your description of what needs to be in there, of the risks, benefits, alternatives. Also in the bottom section for timing the improved document workflow, the fact that we can electronically route these forms wherever they need to be. We can route them for completion if they are appended and need additional signatures. And then finally, that time date stamp to be able to automatically apply the date and time of signature, of witness, to have that data integrity of the document for when it was signed. So overall, we are offering a better form that meets and exceeds these existing and potential future guidelines that makes it very easy for clinicians to access, for patients to read and understand, to be able to link to that additional education to provide better communication between the patient, family, and clinicians, to really foster that communication, questions, discussion, so a patient feels a part of the discussion about their care. It provides better workflow because you have these forms available to you at your fingertips from within your EHR. Whether you're at a desktop, on an iPad, these forms are very easy to access. You know you have the most up-to-date, standardized form at your fingertips, and you're able to route those forms where they need to go, whether they're pended forms that need additional signatures or they're being archived for immediate retrieval by any OR staff or staff that need to access that form. And overall, that leads to just better outcomes for the patient. They have increased satisfaction. They feel like they have been a part of the process. Better clinical outcomes because there is a very clear definition of what the procedure is being performed, that it's a right or a left-sided procedure, who is involved in that care, that this description of what the procedure is, there is a conversation that took place. Having that form immediately available can even decrease delays in the OR. You're not spending time hunting for forms for consents that were maybe faxed over and held for a couple of days until that patient came in. And then ultimately better outcomes as far as your compliance and legal teams. You know that you have a very comprehensive, robust form, again, that is meeting and exceeding the requirements outlined by the governing bodies that you report to.